I'm Benjamin Laser. I'm a radiation oncologist at the Hildegard Medicus Cancer Treatment Center at Samaritan Hospital. My role is to oversee the radiation treatment delivery. I meet with the patients and go over a treatment plan with them and let them know step by step what to expect. I help develop the radiation plan, working with our dosimetrists and physicists to figure out how to target the radiation beam exactly where we need to go. Cancer care is complex and often requires a combination of radiation, therapy, chemotherapy, or surgery. So I had the unique opportunity to collaborate very closely with physicians from the other specialties to develop a personalized cancer treatment plan for the patient. We really try to comfort the patient as much as possible. Going through cancer treatment is often a very stressful and difficult time for the patients, and just helping guide them through the process, and not just the patients but their families as well. Because everybody's cancer is different, and so we look at everybody individually and figure out the best way to target and treat that patient's cancer. I chose a career in medicine because I was looking for something where I could relate to people and develop relationships with people, and I felt that medicine was the best profession for me. Samaritan Hospital is unique in that it is a smaller community hospital, but it has access to some of the best care around. So we have the best technology, we have the best people, and we really treat the patient as a whole. Patients don't feel that they are a number going through a big hospital system. We really get to know them very well and build a very good relationship with our patients.